Hi, my name's Anthony Howell. I'm the sales manager for the Federal Employee Health Benefits here at SelectHealth. Today, I'm going to take a few minutes to talk about what we're offering our federal employees in 2023, as well as talk about a few value adds that are unique to SelectHealth. So, thanks for logging in. So, here we are going over the SelectHealth 2023 benefits for the federal employees. Most people here in Utah are at least somewhat familiar with SelectHealth and or Intermountain Healthcare. The truth is, Intermountain Healthcare owns SelectHealth. We're actually the healthcare arm of the Intermountain Healthcare system. SelectHealth being the health plan that offers the coverage, and Intermountain Healthcare being the health system that provides the care that you and your loved ones receive. Now, one thing that I'm not sure if everybody does understand is that we are also part of an integrated system. And what I mean by an integrated system is that there is a seamless transfer of information regarding your care whenever you are seen by an Intermountain Healthcare facility and SelectHealth's insurance plan. So a lot of people say, okay, the word integrated, that's great, but what does that mean to me? I want to take just a minute to go through what value that adds to you and why this is unique to the setup of Intermountain Healthcare and SelectHealth. So an integrated system actually provides three types of advantages to our members that they don't get anywhere else. And it's strictly because of the structure of the integration between SelectHealth and Intermountain Healthcare. First, it enables your doctor to manage your care at a higher level. Now, when you think about it, when you have a doctor that's tasked with managing your care as effectively and efficiently as possible, they know exactly what's happening with you in their office. But what happens when you go to another specialist there? Or maybe you're accessing medications through another healthcare system. The doctor that's tasked with managing your care often has blind spots because they have no idea what's happening in these other offices. And as a result, the person that you're leaving to make sure to maintain and help you with the healthiest life possible no longer has all the facts or all the information. At Intermountain Healthcare and SelectHealth, this integration allows us, through this transfer of your information, to eliminate any blind spots so that all of the healthcare providers that are working collaboratively to manage your health can do so at the highest level. There are no blind spots, and there's no missing pieces to the puzzle. Secondly, an integrated system also can decrease the redundancy of tests and appointments that may be being set up. Again, where you go to one doctor's office and they order a lab or a test, it's not uncommon when you go to another office where they order the same lab. In this integrated system, again, the information regarding those tests, the results that have concluded, are shared with all healthcare professionals involved. So you're no longer needing to have some of these tests done. It also saves you a lot of time because you're not having to set these appointments up to have the test done and then yet another appointment to discuss the results. This integrated system allows all doctors to work together, again, collaboratively with you to discuss what the best treatment is moving forward and the best method of action. And then lastly, it lowers your out-of-pocket cost. And this is really a combination of the two previous, where your doctor is able to offer a higher level of care. You're able to reach your health quicker. And when you're not paying for additional services that may be redundant or unnecessary altogether, again, you're paying for those. So that, in turn, lowers your total out-of-pocket costs as an individual. All right, so now I want to talk a little bit about benefits that we've upgraded or just upgraded the experience that you have. I want to point out that SelectHealth, we are a very member-centric company. And what that means is that it's all about your experience as our member. We understand that when you access healthcare, something's wrong. You're either sick or you're injured. That's why you're needing care. And there's probably never a better time in your life where you or your loved ones would need access to information and need assistance to navigate what to most people seems like a complex and a confusing system. The health system is confusing, but we're here to help you navigate that and help your experience be as positive as possible. Virtual care is something that we've seen a huge increase in terms of popularity, especially during the pandemic, where people are trying to social distance. And Select Health offers virtual care, but we've also expanded it on a whole other level. And that is that you can actually set up a virtual appointment with your personal doctor. This is the doctor that you already know and trust. So it's a great benefit to be able to use this. Now, obviously, everything can't be seen or done over a virtual consultation. For example, if you needed to go in and get an x-ray, you're going to need to go into the office for that. But virtual appointments with your own primary care provider are excellent for things like preventive checkups, mild chronic conditions, and even prescribing prescriptions. Teleca imaging is also something that's new this year. Teleca Imaging Services is an imaging service center for Intermountain Healthcare. These are imaging services that do both minor and major diagnostic tests. Now, we cover minor diagnostic tests at 100%, but it becomes more important when you're talking about those major tests. Those are so much more expensive. At Teleca Imaging Services, if one of our members chooses to go to one of these freestanding imaging centers rather than have that imaging done at a hospital, they will notice that the cost for their MRI is a global fee of only $550. A CT scan is a global fee of only $350. This is 2.5 times less expensive than the national average. Ambulatory surgical centers are another new adjustment that we've made to our benefits this year. Most people, when they have outpatient procedures done, have done them at an outpatient hospital. But this year, we're offering our members the ability to go and have those outpatient procedures done at an ambulatory surgical center. Now, the same doctors that provide these procedures at the hospital will actually be doing them at the ambulatory surgical centers. So you're not losing any quality or skill in having this done at this other facility. However, the ambulatory surgical centers are much less expensive to have the procedure done. So our members are able to save a lot of money if they make this choice. We've actually learned that about 60% of the outpatient procedures that are done in an outpatient hospital can be done at one of our ambulatory surgical centers. Next, I want to talk a little bit about customer service. I already mentioned how important customer service is to us and how important you are as our members. But we want to provide the best service possible, and we have a number of ways of doing that. First, we do have our member services line. This is a great resource for people to call in if they have any questions. That could range anything from how is this medication covered or how much would it cost me to is this provider in network, or if you even have a question about billing or anything else. Member services is a great place to start, to call in where they can answer your questions or get you to where you need to go. Our next feature is online customer services. And this is a great alternative to people that would rather chat than actually pick up the phone and have a conversation that way. And then lastly, I want to mention our member advocates. This is a team of people that work with you to help you understand which doctors will work best for the type of care that you need. But they go beyond that, and that they can even help schedule appointments with those doctors and help you understand how to maximize the benefits that you have. You can see that all three of these resources are open weekdays. They're there early from 7 a.m. until 8 p.m. And they're even open on Saturdays from 9 until 2. At the beginning of my presentation, I mentioned the importance of managed care and how the integration with Intermountain Healthcare and Select Health really do provide us an advantage to offer and manage someone's care at a whole other level. But I want to point out that you actually have a whole team of people that work with you and your doctors to collaborate and make sure that you're getting the most appropriate care possible. They can give you one-on-one support for all of your health needs. They can help connect you with community resources and even help manage chronic illnesses. Now, I know that I mentioned virtual care with your primary care provider earlier in this presentation, but I wanted to take a minute to talk about all of our other virtual care options that we provide for our members. We have a nurse line, which is an excellent resource for people to call in to get health answers. You still have access to our Connect Care program, which is really urgent care. This is for a time where Possibly you wake up in the middle of the night. It's after hours. Doctor's offices aren't open, but you need to talk to a healthcare professional. It's a great way to not have to drive in physically and see someone in person, but still have the ability to talk to that healthcare professional and get advice about what should be done. Connect Care Behavioral Health is something that I really want to stress. We understand that through this pandemic, we all understand how much more we've had a spotlight on mental health and behavioral health and how important that is. And so this is a great feature because it offers access to behavioral health and mental health professionals, but through a virtual path. You will actually using our Connect Care. When you call for behavioral health reasons, you can actually choose from a licensed clinical social worker or a psychiatrist that's able to prescribe medications. And I need to take a minute to talk about preventive care. Preventive care is so healthy. As a health system, we really focus on trying to get people healthy. But what's so important and really so much easier is helping people to maintain the health and the wellness that they already have. Preventive care is an excellent way to do that. And the best news is it's zero out-of-pocket cost. Preventive care covers several things, but just to name a few that are very popular, it covers annual physicals, mammograms, colonoscopies, certain lab tests, most immunizations, and many pediatric services. Now, we all know that prescription medications can be very expensive. Through SelectHealth, our federal employees have access to all major chains. That includes over 55,000 pharmacies. On both of our plans, we do offer 90-day supply for maintenance drugs. It's a great way to get additional quantities at a lower cost. And as far as pre-authorization for medications, used to take days, and now we've got it down to where we can have it done often in just hours. Lastly, I just want to follow up by saying that we do have a free home delivery service, both for our Intermountain Pharmacy, but also for our specialty pharmacy. It's a great way to conveniently have medications delivered to your door. And as I mentioned earlier, that is free, so there's no extra cost for that delivery service. We also have an RX tool called RX Saving Solutions. This literally has saved our members millions of dollars. It's a website that will show you lower cost prescriptions than what you're currently taking. So if there are some lower cost options, it will point those out for you and for any of your family members that are listed and are registered in this program. RX Saving Solutions will also contact you anytime you're spending more than you need on current prescriptions. And they take it a step further. They'll work with your doctor to get approval as far as switching to a more affordable prescription if that is the most appropriate course of action to take. Now I want to take a minute to talk about our networks and our coverage. I'm going to start off by talking about our high deductible health plan. Members that are enrolled on our high deductible health plan will use our Select Med network. Our Select Med network offers access to 100% of the Intermountain Healthcare hospitals, facilities, and providers. But it's important to note that we also contract with thousands of non-Intermountain Healthcare providers. This includes Tanner Clinic, Ogden Clinic, Granger Clinic, just to name a few. We also have what's called urgent and emergency care. And how this works is when you're traveling outside of area, if you get sick or injured, what do? Your doctor generally doesn't travel with you, right? So when you're away from home, if you get sick or injured, you go to the urgent care center. If it's more serious, you go to the emergency room. This is where urgent and emergency coverage comes to play. You have worldwide urgent and emergency coverage with Intermountain Healthcare and SelectHealth, which means that anytime you're away from home, if you get sick, go to that urgent care center and your coverage will be treated the same and cover you the same as if you came to one of our urgent care centers right here in Utah. We also have what's called out-of-area dependent coverage. Now, this is for people that have children on their policy, but they're living away from home and out of area. We all know that our children can stay on our plans up to age 26, so this often overlaps at that age where kids are going away to college. So if you do have a child that lives outside of Utah, they need full coverage in the state that they reside while they're going to school and while they're away from you. This out-of-area dependent coverage provides full coverage for them. We've contracted with a very large national network so that they will have no problem finding access to any providers, hospitals, or doctors that they may need while they are living away from you. So this is our high deductible health plan benefit. Now, as you can see, and as it says in the name, it does have a higher deductible. At the top there, you can see there's a $1,500 deductible for a self. And for a self plus one or a self and family, it has a $3,000 deductible. Now, a lot of times people, they hear the term high deductible and automatically they think, okay, that's not for me. Why would I want a high deductible? But let me talk to you a little bit about why these plans are appealing to people. Firstly, they're less expensive. They don't cost as much premium to have the coverage as a copay plan does. But secondly, and this is the big difference, there's something called an HSA premium pass-through. Now, HSA stands for Health Savings Account, and it's exactly what it says it is. We take a portion of the premium that you pay us to have the coverage, and we pass that back to you. We deposit that monthly into this health savings account, which you own. Now, if you're a self, you'll get a monthly deposit of $75 deposited into your HSA. If you're enrolled as a self plus one or a family, you'll get $150 deposited into your HSA each month. Now, you can do the math. Over the course of 12 contributions or over the course of a year, if you have $75 deposited, that's $900 you're getting back in money that you've already spent to have the coverage. And that money just sits there in that health savings account for you to use for your medical care when you need it. Now, I said it was $150 for a family. Again, doing the same math over the course of 12 months, that's $1,800 you're getting in your HSA over the course of the year. So now you can start to see if you're somebody that doesn't go to the doctor very often, maybe you're not taking expensive medications, and you're looking for a way to keep your healthcare dollars in your pocket, rather than send it off to an insurance company that you're really not getting a lot of services from. A high deductible health plan might be a plan for you. I personally am on this plan with my son. I'm a single dad, and we've got over $30,000 that we've saved up over time because of these HSA premium pass-throughs, and because we can also contribute additional funds and save the tax dollars that would have been taken if we put it in our HSA instead. So how this works, and one thing I think an easy way to wrap your head around it is to look at it as a deductible first plan, meaning you do have copays on this plan, but that deductible has to be met first. So if I go to a doctor, I have to pay the actual cost of that doctor's visit up until that $3,000 deductible is met. Now, I'm pretty healthy, and that's why this plan appeals to me. I go to the doctor maybe once or twice a year. So if I go to a doctor and I have to spend $100, and say that happens twice in a year, I've spent $200 in doctor's visits, which may sound like a lot. But if that's really normal for me, and that's about what I use in terms of my healthcare utilization, I'm happy to spend $200, because that $1,800 that I got through my premium pass-through has left me with $1,600 to spend moving forward. The great thing about these HSAs are that the money rolls over. It's not use it or lose it, but it rolls over year after year as it grows and it accumulates. And so you can start to see how somebody that's relatively healthy, isn't taking expensive medications, can use this as a source to build a nest egg where they have funds set aside specifically for their health care whenever they and their family need to use it. Now let's talk about our standard option and the access that members have when they are enrolled in this plan. This plan will provide the same access as the access that you have on the high deductible health plan. You still have access to all of the Intermountain Healthcare hospitals, facilities, and providers. You have the virtual care. You've got the worldwide urgent and emergency coverage. But we've also extended coverage on this standard option to go across the entire United States. How we've done that is we've worked with United Healthcare, which is a very large national carrier, and they have a huge network in every single state where they provide doctors, hospitals, facilities, and we've agreed with them that our members that are enrolled on our standard option will be able to access when they're away from home
and out of area, they can go ahead and they can access the United Healthcare doctors, facilities, providers while they're away from Utah. This literally provides coast to coast coverage in every single state you go to. So this puts us on a level playing field with other national carriers while still providing that amazing benefits of being part of an integrated system here at home in Utah. And this is a quick look at the United Healthcare Options PPO network, which our members on our standard option will access. You can see 83% of hospitals across the United States are included in this network. 2 out of every 3 healthcare professionals are included in this network. And as I mentioned earlier, in addition to have coverage in 50 states, you still have access to urgent and emergency care worldwide. So should you get hurt or injured while you're traveling abroad, you still have coverage for that. And lastly, we come to our standard option. So this really hasn't changed from last year. You can see the deductibles are the same. We've got a $250 deductible for a self and a $500 deductible for a self plus one or a self and family. Now keep in mind, these deductibles only apply to major medical or your higher tier medications. When I say major medical, think inpatient care, outpatient hospital, emergency room, things like that. The regular day-to-day going to a doctor, there's no deductible that applies. You've got a low $15 copay to see a primary care physician. You have a low $35 copay to go see a specialist. You still have access to those virtual consultations. And as you can see on this slide, that's a $0 copay. So it's not only extremely convenient, but extremely affordable. And then as you look down toward the bottom of this slide, you can see our prescription drugs. We have a 4-tier prescription drug. Tier 1, the deductible will not apply. That's for generics. It's a $5 copay, but I want to point out that it's up to $5. Oftentimes you can find generics that cost less than $5, and if that's the case, you pay the lesser amount. Now, as you get into tier 2, tier 3, tier 4, those are your prescription medications, your injectables, your specialty drugs. These are more expensive, and so there is more of a cost share associated with these. And you will notice that it says after deductible. The good news about this is the money that you spend toward these higher tier medications chips away at that deductible that you have for medical. So you get credit for the money that you're spending on these higher tier medications. Another thing I want to point out, and this applies to both of our benefits that we offer, both the high deductible health plan as well as our standard option, is we have a very simple, easy to use wellness program. And we provide incentives for using this wellness program. But the reason why I'm bringing it up here is because the incentive happens to be the exact dollar amount as the deductibles on this plan. So for a self only, you can earn up to $250 by doing basic wellness activities. We'll pay you for joining a gym. We'll pay you for doing a health assessment, but we also will pay you if you jogged with your dog for a mile or maybe went on a family hike. We make it very easy and simple for people to be able to earn money. The whole point is to motivate people to get out, to think about wellness, and to move. $50 at each of these incidents that you report, up to $250 per person, and up to $500 per family. So if you caught that, because it's the same amount as the deductible, should somebody want to take advantage of this wellness incentive program, they could actually earn the money that they would have to pay toward a deductible, making this a zero deductible plan essentially. Or in other words, you're not having to spend money out of your own pocket if you did meet that deductible that year. So that concludes our overview of the 2023 benefits for our federal employees. We're looking forward to a great year with you. If you're a member, thank you. And if you have not signed up with Select Health, hopefully we've given you a few points to consider as to why we may be the best fit for you.
And I also would like to take just a moment to thank you for your civil service as a federal employee. We appreciate the work that you do for us and for our country. If you have further questions or would like to know more detail about anything that I've discussed, you can log on to our website or you could call our member services line where we have people that are ready and anxious to chat with you more.